Hey, what's up everyone? Dr. Stein here over at Straight Ahead Chiropractic. There is a whole bunch of conversation and a lot of talk, especially lately in the last, probably 6 months, but even more than that, maybe the last couple of years, of this whole idea and notion of birth trauma and why babies might need chiropractic care. Or I could take it a step further and say why babies probably should be checked early on. How early is too early? Well, personally, I think that the sooner you get them checked, the better off. If they don't need anything, then awesome. We high five and they don't need anything. If we find something that they need some help with, early intervention is the key. So I just want to take a few moments to talk a little bit about kind of getting around why there might even be a need in the first place for chiropractic care and what chiropractic does. And I put a list here, a little bit of a whiteboard discussion here so we can kind of jot down some ideas and have a little bit of a conversation about that. But specifically, what is it that might lead to the need for a kid or a baby to get checked? And really that boils down to stress. And we boil that down, or we discuss that in multiple different areas and multiple different things. And here's the idea, is that the labor and delivery process and the pregnancy process is a natural process. Your bodies know what it's supposed to do, and given the right environment and the right context and the right neuroregulation or the neurological feed and the right biomechanics and structure and alignment, it should happen naturally. I was just talking last week with an OB friend of mine who delivers thousands of babies. And the first thing out of his mouth is he's like, the whole labor and delivery process is a natural process, and sometimes intervention is necessary, but for most of the time, it should just happen naturally, except for X, Y, and Z. And that's what I want to talk about with X, Y, and Z here, is that various things. We know stress is cumulative, and so pregnancy stress, and that's anything from like preconception stress, whereas like maybe you struggled to get pregnant, or maybe you got pregnant really easy and didn't expect it, and that's stressful to you. Maybe you weren't ready to have kids, or maybe you're going through some difficult transitions in life in the middle of pregnancy, and so there's emotional stress that's weighing you down. And then maybe there's things like you got one of your tests back and it gave you a scare, or you had back pain during your pregnancy, or maybe gestational diabetes, or all of those things, right? We don't want to talk about all the things that could go wrong, but we want to talk about a lot of those things are common issues. And anxiety and stress is a normal process. I think that's part of like turning you into mama bear, so to speak, which is a good thing. You should be protecting your cubs, so to speak. But I think that part of that is that in that process, there's a little bit of anxiety of, are you going to be a good mom? Are you going to know what to do? Is your baby going to be safe? And those are natural thoughts and questions. But then there's also the pendulum swung the other way, where there's just things in society that just scare us, like what to expect when we're expecting. That book is full of resources, but most of those resources just scare the snot out of you, because they're like, this is where things should be and this is how things could go wrong. And so with that, I just want to kind of unpack some of this and talk a little bit about just stressors and how they accumulate and how they might influence or affect baby. Mom's nervous system, your nervous system when pregnant is baby's nervous system. They're sharing your nervous system. So if you're stressed and your cortisol levels are high, that's how you're hardwiring them. That's where they are starting to get those things. Okay? Don't hear this as guilting or shaming by any means at all, because we can help 100% with this stuff. This is what we do on a daily basis. But I just want you to know where some of this comes from, because we get asked all the time, why would a baby need to see you? Well, here we go. So we talked about preconception stress. Were you able to get pregnant? And then pregnancy stress, labor and delivery stress, different checks, lights, positioning, kind of what environment are you having the baby in? Are you in a hospital? Are you at home? Are you secure about being at home? Are you apprehensive about it? Are you in a hospital? Are you apprehensive about that? Are you stuck in one position? Are there flashing lights around you? Are there people constantly coming and checking on you? Are you allowed to rest? Do you have other kids present? Is your support team there? Are you breathing appropriately? All of these things, right, are maybe good, maybe necessary, but they're cumulative in that they are stressful and it adds up, okay? So with that, then there's other things like IVs, epidurals, inductions. Sometimes are necessary, but not without consequence. So was there an induction? Was Pitocin used to increase uterine contraction to expedite things? Was there an epidural? Were there pain meds? Was there an IV? Was a C-section necessary? Again, this isn't a rant against the medical establishment, because that's not what I do, and that's not really how I am. I'm not anti them by any means. C-sections save lives, right? And I've never given birth to a baby, so I probably honestly would do an epidural because I don't really want to suffer through the pain of that. But all things aside, this isn't saying passing judgment, good or bad, one way or another. This is just saying every choice that we make and everything that we do has consequences. Babies are supposed to come through the birth canal. If baby can't come through the birth canal and needs a C-section to be alive, praise God that we can do a C-section and save that baby's life. That is in and of itself miraculous miracle through medicine. And I'm all for that. But if it doesn't go through that natural process, then there's neurologic consequences, because baby needs that process to trigger and start some of the foundational neurologic processes necessary for neurodevelopment. And if that doesn't get triggered through labor and delivery, that's where we come into play, because we can help with that. We can help trigger that stuff and get everything organized and really modulated and regulated neurologically the way that it should. But you take these things into consideration, and if you just do simple math, right? Pregnancy stress, induction, Pitocin, epidural, C-section, and let's just say life, right? I mean, big assumption, you're not supposed to assume, it's not polite and all that kind of stuff, but big assumption, this stuff is stressful for you. And all of this stuff leads to trauma. Specifically birth trauma. We don't classify birth trauma just to like a blood pressure or heart rate drop in an emergency C-section. That's traumatic for sure. But stress is cumulative in nature. And so they build over time. So it's one thing plus another thing plus another thing plus another thing. Rarely does one stressor ever cause people to be derailed. Ultimately, our bodies are hardwired to be able to manage stress and respond appropriately. We have a specific division of our nervous system, the sympathetic division of our nervous system, the fight or flight response, that increases cortisol levels, engages the adrenals to give us some adrenaline, and we're supposed to be able to handle stresses. But if that stress is unrelenting and cumulative, it can outweigh our ability, or it can overcome our ability to appropriately respond and adapt. And then that causes our hardwiring or our nervous system to be reprogrammed and repatterned, where we get stuck in the stress cycle. So colicky babies, gassy babies, failure to latch babies, failure to thrive babies, constipation, focus and attention issues, chronic ear infections, allergies, asthma. Most of those things are rooted to some form of dysfunction. We can all day long theorize as to what the best treatment is to get rid of those symptoms, but I have a better solution and a better suggestion. Let's ask the question, why are they there in the first place? And here's what we know, because this is what we see hundreds of times every single month. This is what we see. Histories like this, coming in with cumulative stress, babies are tense, bottled up, bound up, their nervous systems and spines are just locked up. We do some chiropractic care to unwind their spine. Their nervous system gets into a better state of adapting and responding. It becomes more resilient, starts functioning, healing, regulating naturally like it's supposed to. And as a result of that, a lot of the other things, the symptoms, the overflow, which is really colic and gas and reflux and all those things, are an overflow of another dysfunction. When the function is restored, that dysfunction is gone. And when the dysfunction is gone, the overflow naturally isn't there anymore. When the body starts handling those situations and responding more appropriately, when you get rid of the cause of the issue in the first place, you don't have to worry about the symptom treatment anymore, because the symptoms are gone as well. And so chiropractic doesn't focus its attention on treating the symptoms, and it doesn't, the aim and goal isn't to have a baby with reflux to stop spitting up. We want that to happen, but we want to answer the question, why are they spitting up in the first place? What is leading to that? Is it a latch issue because they're having some vagal nerve tone issues to where their soft palate can't elevate and retract and cause enough suction so that they're not able to really do the suck, swallow, and breathe rhythm, and they're getting too much air trapped? Are they constipated because their GI tract mobility and motility is just suppressed and it's not working efficient? Are they more stressed out? Are they hyper-responsive? Are they having meltdowns? all of those things put into the equation, we know that our bodies are constantly neuroplastic. And what that means is our nervous system is always adapting to the environment, always responding to stimuli, and always learning from that. And so if there's garbage coming in constantly and that information that we're getting is stress, 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 then we get hardwired for that. So then we become hyper responsive to everything because our body's just constantly just waiting for stress to happen. We become like Debbie Downer or like really pessimistic. And babies can even be this way too, where they're just constantly thinking that a stress is coming at them. And then that hardwires them into this vicious cycle of they're stuck in stress, so now they're sick. Now they're sick, they're stuck in more stress. Now they're sick and they're more stressed. And it just becomes this one on top of another. I propose to you, come get your baby checked, have your kiddo checked, have yourself checked to see, is there neural compromise that's causing you to be stuck in that stress pattern to where you can break out of that cycle, have a breakthrough, and you can see some life-changing results and transformation, because that's what happens at Straight Ahead. Hope is straight ahead, life transformation is straight ahead, and it all starts by getting to the foundation. The nervous system is the master controller, and if that's not regulating well, it doesn't really matter what other treatments or protocols you do, they're not going to be as effective as they can be, because the nervous system needs to be functioning at its maximum capacity, because otherwise health cannot be achieved at its max capacity. Hope is straight ahead. Reach out to us if you have any questions. Hope you had got some information or benefit from this talk on birth trauma. If you have more questions specifically about birth trauma or just how we can help and what it is we do and the results that we get in our office, we'd love to chat. Thanks so much. Have a great day. Hope is straight ahead. Bye.